Good day. My talk today is on self-medication in Nigeria. What is self-medication? Self-medication, simply put, can be described as a phenomena where an individual self-diagnoses himself of an ailment and goes ahead to recommend medication for use. Put it in another way, self-medication is the use of drugs to treat self-diagnosed illnesses. The prevalence of self-medication in Nigeria is quite high. A lot of studies have put it at 52% to as high as 94%. In fact, there are some studies that put it at as high as 98%, which is very astronomical. Why self-medication? People, in fact, citizens undertake self-medication for many reasons. One of the reasons for self-medication is how easy it is and very convenient. There are many enablers of self-medication. What do I mean by enablers? That is, those factors that promote self-medication. Number one is unregulated drug administration. That is, in Nigeria, we have laws and rules that guide how medication should be accessed. We have over-the-counter medications which a citizen can easily access from any patent medicine store, and there are prescription medicine only medications that are supposed to be obtained with valid prescriptions. Another enabler of self-medication is the inavailability of access to health care facilities. Many places in Nigeria, in the hinterlands, do not have access to health facilities, be it primary health care, community pharmacy, and other health centers, because we have many health facilities aggregated in urban areas. What are the dangers of self-medication? Before talking about dangers, let's talk about why do people use self-medication to treat some common illnesses. Some common illnesses are managed through self-medication, like cough, catarrh, diarrhea, running stomach, headache, fever, and so on and so forth. What are the dangers? The dangers of irresponsible self-medication, I must say, are many. Why do I say irresponsible? Because if you undertake self-medication with control, definitely that will be a plus to the healthcare system, because common illnesses that can be managed with over-the-counter medications can be treated through self-medication. But the problem is when a citizen that is not adequately empowered with health literacy does not know the limits of his treatment. So the dangers are over misdiagnosis, over drugging, that is polypharmacy, then leading to antimicrobial drug resistance, and also adverse drug reactions. What is the message? The message is, yes, you can manage yourself for basic headache or some common flus, but you need to know that any headache that persists for more than 24 hours is no longer a common headache. It's a symptom of an underlying condition. Make sure you meet your pharmacist as well as your physician so that you can be managed properly, diagnosed properly, and given adequate care. Remember, self-medication is deadly if it is not done responsibly. make sure you reach out to your pharmacist as well as your physician for proper diagnosis and care. Thank you.